Today, Chuck and I are here with Dr. Mary Lynn McPherson. Stay tuned, we are coming right up.
You have instructional design questions. We discuss answers.
Dr. Mary Lynn McPherson is professor and executive director with advanced postgraduate education in palliative care in the Department of Pharmacy, Practice and Science at the University of Maryland School of Pharmacy in Baltimore. Dr. McPherson has a master's degree in instructional systems development and a master's degree in distance education and e-learning. Dr. McPherson has maintained a practice in both hospice, local and national, and ambulatory care her entire career. She is the Executive Program Director of the Online Master of Science and Graduate Certificates in Palliative Care at the University of Maryland, Baltimore. She is also delighted to announce that this program will be extended to an online PhD in palliative care, pending approval of the Maryland Higher Education Commission, starting fall of 2021. Dr. McPherson is particularly interested in the safe and effective use of medications in patients with a life-limiting illness, ranging from drug selection, deprescribing, and risk mitigation. Welcome, Lynn, to our program. We're so excited to have you with us today.
Thank you. I'm excited to be here.
You know, those of you watching this are in for a treat, because I can tell you, as someone I've known for a while, but someone I've really respected. And when I think that I'm not doing enough, I look at Lynn and she's done twice as much as I could ever do. This is someone that never stops. And where that shows up in all the accomplishments of things that she's done. And you're always doing things for other people. This is never about you. It's never about your career. It's about what can you do for people that makes their lives better. And the thing that draws me to you and to the story that we're going to talk about is the fact that instructional design, at least for the last, 10 years or so, has been part of the way you've looked at the world. So starting with your PharmD, you would think you wouldn't really need to go anywhere else for an education. You decided to come back as a grad student in instructional design and get your master's there. Yeah, where I was privileged to serve with you as you went through that program. And not only that, you went on to win the Marvin J. Cook Award as the best student for that particular year, which escapes me which year, but that's quite an honor in our program to be able to do that. So
Definitely.
after that, you then went on and put this master's together, and now you're at the very threshold of a PhD program. And in both of these, you've included courses in ISD.
Absolutely.
And I would really love to hear this story. I mean, we've talked about this many times, but we've never talked about it in this context. So tell everybody, how do we get from A to Z?
Wow, it's a long and winding path. First, I think, I embarked on the ISD master's degree at UMBC, where you were an amazing professor, I may say. You were just such a clear professor, and it made so much sense, and it was so practical. It was really what I had been looking for, and it validated everything that I had thought was best practices in teaching, and took it to the next level. And then even after that degree, I got a second master's degree in distance education and e-learning. So between working, nothing else to do, between working and practicing in hospice and palliative care for 25 years at that point, and the 2 degrees, I knew I wanted to move forward and offer this advanced degree to people in palliative care. I think, we've only got about 20 master's degrees worldwide in palliative care. And it really is an emerging field for, one thing. I mean, when you compare to internal medicine, which is 3,000 years old, palliative care is only about 40 years old. So we really need to include these opportunities for people. Why did I think instructional design is important? For me, in designing these programs, and more importantly for the learners in both programs, is very simple, because we're all educators. Every pharmacist, doctor, nurse, social worker, chaplain, activity director, everybody is a teacher. And it just slays me that we hire people, even at higher academic institutions, with 14 PhDs and 15 master's degree, but they can't teach their way out of a brown paper bag or design education. So I think this is critically important, that everyone should at least take one course in instructional design if they're going to be formally teaching in an academic institution, but the bottom line is everyone is an educator. I don't care whether you're teaching at a college or you're the pharmacist in a community pharmacy, and a patient comes up to you and says, the doctor told me that you would help me with my diabetes. Can you tell me about XYZ? You have to quickly, on the fly, do instructional design. What are 3 important things I need to convey to this patient? How can I best structure it? How can I use the teach back technique so I can explain it and then ask the patient, can you explain it back to me so that I can make sure I did a good job teaching you? So formative assessment, summative assessment, the whole 9 yards is critically important for all of us. How's that for a
Yeah.
long-winded answer?
Wow,
No,
that
that's
was
a
amazing.
perfect answer. And I'm going to send this to every college and university professor, all 2,800 of them in the country,
Great,
and
just don't
suggest
tell them where I
they get
live, okay?
it. I'll give you your private
My home
phone
address.
number. But see, this is the thing that, as an instructional designer, that I've been trying to get people to understand for a long time. That this is more than just what you think it is. This is more than just designing a course and off we go to Maryland. And it's not that way. This is an integral part of anything a professional does. It's not only systems thinking, but it's this whole notion of you've got to be able to present information in a way that people can retain. And you got to be able to see if they understand it, if they can give it back to you, which we call mastery, and all the other things. And now, even more so, with all the evaluative requirements that people need to show that people can actually do something. What a concept. So it just thrills me, first of all, that you did the master's in palliative care. You included me on the faculty, which was a great risk, I'm sure, but I do
Not
appreciate
at all, not at all. You're my favorite.
but we're going through now and working on this PhD and all the stuff you've done. And how many conversations did we have about writing objectives for the PhD program that MHEC and others would look at? And it was just for me, a very empowering experience with you to see all this in action. How was it from your side?
Oh, it's exciting and it's thrilling and it's terrifying all at the same time. I have so many hopes and desires and fears. I probably need drug therapy at this point, but it's just so exciting to me because certainly a PhD is about research. We all know that, but I am a greedy little bugger and I want it to also be about leadership and about education and about vision and engagement in the community and in the profession. So I want these learners to walk away as very well-rounded individuals who can certainly design and execute and disseminate new findings and research, but also to be amazing educators and visionaries and leaders. I don't know, maybe I'm asking for too much, but I'm going to go for it. What do you think?
I think you should go for it, Lynn. 2 things. First, you're so passionate about your field. It just shines right through the camera. It's amazing to listen to you. And I always like to ask this question of people that I interview is, where is that passion rooted? Where did this start from? Where did your passion in palliative care come from?
Oh my gosh. I mean, the ability to make a difference is profound. That's part of my personal mission statement, is to make a difference. I mean, hospice care, palliative care can be very sad. I'm very sorry that people are in this situation. Some people die so hard. But if I can do my little part and make it so that somebody dies not constipated or vomiting on their sneakers, or a doctor calls me and says, I can't figure this out. This patient's pain is horrific. This child is screaming in pain while they're dying, and the parents are going to remember that. And I can come up with some crazy idea to fix it. I mean, it's not an ego trip. It's just enormously, I just feel like I'm really contributing. And I feel equally passionate about education and making sure. I mean, I love that all the people that provide hospice and palliative care, and we are a team. It takes a village to get this job done. I'm a huge believer in not only being interdisciplinary, but transdisciplinary. A social worker cannot walk into a patient's room and the patient say, the doctor said I'm going to die in 3 months. What do you think about that? The social worker cannot say, oh, let's go get the doctor. The social worker has to stand up and deliver. The chaplain has to be able to explain, why do the opioids cause constipation? And as a pharmacist, I have to be able to explain or respond to, do you really think there's a God? Or do you think I'm going to go to hell when I die? Because I've been a naughty kitten for 85 years. So we have to be transdisciplinary and be able to stand and deliver.
Wow, yeah, and the education, the root of that education purpose It's right there. It's the fact that you have such passion for this field, for what you do, that transcends into the education part. You want others to have that same passion and purpose
Absolutely.
behind their work.
Absolutely. Of course. And I have to say, palliative care people are warm and fuzzy people. I mean, this is why people go into healthcare. They want to help people. And this is the ultimate. This is Mount Olympus of helping people. Absolutely.
And I think this is the key to instructional design, is giving people information that's real. And I've argued this in law enforcement and in the fire trades and emergency management, that if you don't put people in the scenario that they're going to actually operate in, then you've done this a disservice. And I see this over and over again with the few students that I have out of your programs. And the stories that they tell, and you don't know this, but there are times I sit there and tears running down my face
Oh.
in these courses because, it hits me and it's real. And there's no backing off from this reality. You can't take a vacation and, people get better, and it's not fairyland. This is the real world. Instructional design should be there to make sure that the people that operate in this real world have the tools that they need to be able to do that.
I think we owe that to our students. We owe them
Absolutely.
a quality experience that is highly practical and engaging, and it's real life, and it's not, I don't know, the 2 master's degrees I did, sometimes my biggest takeaway was what not to do in instructional design or in teaching, particularly online. And that's a valuable lesson right there. But I really enjoy creating learning that is well grounded in theory and gives students the opportunity to practice that skill. And the order matters how you do instructional design. It's so tempting to jump in with the first module and say, what should we do this week? Which is completely the wrong thing to do. You've got to start with the end in mind. So.
Well, thank you for saying that. I'm going to print that into billboards.
There you go.
And put them around certain organizations.
That is the that is the tagline. I will do that with marketing UMBC's ISD
Denise
program
has
as
got
well.
a whole new concept now. So we're going to ask you 3 questions and see what you think. So Denise is going to hand these to you very softly, and then you can hit them out of the park.
Very softly. Before we begin, I have to say, the second thing that I wanted to say to you was, I have been marketing this program for ISD at UMBC for 14 years, and I remember you from when you won the Dr. J. Marvin Cook Award. I said to Chuck when he mentioned we were going to be interviewing you, I saw your picture and I said, she looks so familiar. And then he told me that, and I was like, yes, I remember that. So anyway.
It was quite an honor. I remember when Dr. Robert Kerr did the graduate certificate. And then he came back to our School of Pharmacy and he redesigned our whole curriculum. And if I had $1 for every time I heard Dr. Cook said, I could literally buy your campus, I think, because he was
the man.
He was
still
the man.
Yeah.
Absolutely. Oh. Okay, so let's start with our first question, Lynn.
Okay.
What is your favorite ISD project and why?
Well, I mean, there are so many to pick from. I would have to say it is the master's degree. And then, of course, now looking at the PhD. I think first to back off is what do I love about ISD? And what I love about it is it lets you use both sides of your brain. It's the left side of your brain where you've got this structure. And if you follow the recipe, you're going to end up with an amazing product. But then you've also got the right side of the brain. You can go totally off-road and design some crazy activities that make the learning so fun and engaging and practical and applied for the students. So in designing the master's degree, I think my very favorite compliment is students who say, oh my gosh, I learned this Monday night and Tuesday I did it at work. That's my payday right there. I love that. I also, one thing that they did, it used to be UMUC, is they would have a metacognitive process granted at the end of the program, and so did UMBC with the portfolio at the end. I love that so much that I've incorporated that into all of our courses every other week, where students write a very brief reflective post. And I sit there and cry and read those half the time because they're so moving. So that's just part of my favorite parts of what I do.
The reflective part is so intriguing. That really is. I agree that is an important process, a brain process, a heart process. It really helps you to think about your wins and losses, risks, and all of that stuff, the benefits and the lessons learned, because without that reflective process, it's really hard to know what your lessons are.
And you don't even realize your reflections until somebody makes you do it. I love reading when students say, I love when a physician says, I can't believe you made me learn how to assess pain. I'm the medical director of a 8 billion bed nursing home. But then I did weeks 1 and 2. And you know what? I was missing a lot on how to do a pain assessment. I was like, no comment, no judgment from this girl, but I'm glad you did it.
That's the amazing part of this, is that all of us, I think, when we get to a certain point, we get a PhD or a master's or an undergrad or whatever we get, we think we're done. We think we know it all. We think time freezes, nothing changes. There's no continuum here. And I'm never more impressed than when someone like that, and I've had them too, very, people that people would know that run large organizations, and they'll come back and say, you know what, I should have kept thinking about some of this stuff. There's more to this. It's not a snapshot when you're working in this. It's a dynamic process, and I need to be okay with that. And I need to think on my feet. But that's something you have to learn, right? I mean, once you get to a certain point, you think you don't need to learn anymore.
Oh,
And
no.
gosh, I learn something every day. I learn something today. I hope I learn something tonight. But that's a different mindset. And that's something that we can help in ISD too, is to get students and folks to think about, the dynamicity of all this and how it works together.
And I think instructional designers have to be very light on their feet, because I'm a big fan of the 60-year curriculum. So have you heard of this concept of the 60-year curriculum?
Yes.
No, I haven't.
So it's, you're 22, you've graduated college, you think, yay, I'm done. You are not done. You're going to need to be retrained to get more training and different training. I mean, I've reinvented myself about 5 times during my career. So not only do I have the master's and the graduate certificate program, and then we'll have the PhD. After I get that bad boy launched, I want to go back and develop a MOOC for every healthcare professional in the world to learn primary palliative care skills. So you can take just the first level, you can take the middle, or you can go all the way to the finish line, because people have different learning needs as they traverse their career. And that's so important to have that menu available. Very important.
I want to be you when I grow up.
Yeah, I just need to live to be 200 years old.
Well, let's work on it.
Second question. What things did you learn the hard way?
Well, it's hard for me to parse out what did I learn the hard way as an instructional designer versus somebody who's teaching the class, particularly online. But one thing that I've noticed right out of the gate is, do not write a discussion question that you can answer with a yes or a no. That is a very short conversation. So you have to write something where there's a little meat to it, so people can really get their hooks in it and kind of tear it apart. So that's been a big one for me. And I think most of the instructional design I've done, I've been fortunate to it's been in my area, so I could be the subject matter expert. But now with this PhD, over the past couple of days, I have had the revelation that, I might be all that in a bag of chips, but I'm getting over my head in some of these areas. So it's one thing to have experts design each of these research statistics courses, but I want to make sure that they really integrate well and play well in the sandbox. And that's a little above my pay grade right now. So I think I need to seek out a subject matter expert to oversee that, to make sure that it's seamless. And I'm not too proud to say that. So I already have appointments lined up with that. I think another important thing, and try as I might, something always falls through the cracks, is really super, super, super clear instructions. I had a new learner who just started one of our courses a couple of weeks ago email me and say, how do I click to upload an assignment? I said, you click where it says click here to upload assignment. I don't know how to explain that better, but there's always somebody who needs a little more instruction. We have a lot of learners who are mid-career who are terrified of online learning, and you cannot make it clear enough. But by week 2, the technology goes away. And that's part of my job as an instructional designer, to make the technology go away and become invisible and make it consistent from module to module, from course to course, and very, very, very user-friendly. This is a scary thing for a lot of people. So it's my job to unscary it. And I think that's an eternal quest. I think it's hard to make sure you hit a home run. What do you think, Dr. Chuck?
Well, I think you've done an incredible job with it, because of all the things that are designed, and at this point, the master's program, but the LMS helps. It's the same course structure for each course.
Mhm.
So you physically go in and navigate approximately the same way. And after the first term, you're pretty good at it, and you get to know Blackboard and whatever system it is, and off
Mhm.
you go. But yeah, I remember in the very beginning we talked a lot about how we were going to do navigation and how we were going to make this safe, and what was the
Mhm.
the hot button to hit if everything else went south. And you've done
Mhm.
that so well because you thought about, okay, what's the worst case scenario here? What happens when they can't click to download the file? And I have to have an
Mhm.
answer
Mhm.
for that. So
Absolutely.
you use the design sense that a good instructional designer has, an award-winning instructional designer has, to ask yourself, okay, I need to make sure that every one of my learners has this safety net. And I've thought about
Absolutely.
all these things. So you've done a
Yeah.
tremendous job with that. What kind of advice do you have for that new designer? So, Denise and I don't know anything, and you are going to bless us with your wisdom. What would that be?
Well, first sign up for your program, of course, the Instructional Design Masters. That's number one. But
Thank
I
you.
would say, even with that newly minted degree under my belt, it was kind of a shock to actually do it. So, and it's
Yeah.
kind of overwhelming when somebody says, "Here you go, girl. Here's the elephant. Now go eat it." You say, "Oh my goodness, where do I jump in here?" So I really, to reiterate again, beginning with the end in mind. And sometimes I have to slap myself and say, "Just calm down for a minute. Go back to where's the finish line? What will the minimally competent, successful learner look like at the end of this course, activity, master's degree, PhD, 47 degrees, whatever it may be? You've got really tight learning objectives. How do they trickle backwards? What will be the next to last thing they do before they cross the finish line? I think that's critically important. And we talked about the subject matter experts. I think quality is really important. I think you've got the finish line, you've got your TPOs, you've got your course level objectives, then you've got your module objectives, which all build to support each other. I think when you go to do a module, you've got to plan really your summative assessment almost first, and then
Yeah.
think through, okay, so if that's their summative assessment, I have to give them chances to practice. And what information do I have to teach them so that they can practice these skills so then they can take a test on these skills? I love how that house of cards builds. I worship at the altar of quality matters. I think that's really, really important. So I think if you start with your storyboard, you do it the way you were taught, and you can't go wrong. I think that's so, and get lots and lots of feedback. I mean, Addie is more than an American Girl's dolls. It really is cyclical, and the evaluation all along the way is so important. But those are my important things. And I love active learning, whether I'm teaching face to face in the classroom or I'm teaching online. I love to design activities like go interview 3 people and find out about this, or go online and do this. I just love getting people engaged, not only in the discussion board, but going out and doing real life things. I think those are important.
That
That
is
is
so
really
important.
good. Yeah,
And I'm
absolutely.
glad you brought up this whole notion of what they can do at the end. And I always have
Mhm.
people picture when that learner is leaving that room or shutting off that
Mhm.
computer, what can they do that they couldn't do when they turned it on or when they
Mhm.
entered that room?
Mhm.
Describe them, picture them, and tell me
Exactly.
exactly what they can do. And if you
Yeah,
can do that in instructional design, everything else kind of falls in place. And
it
start with
does.
that end picture. If you start in the beginning, you're going to be an unguided missile. You're never
Mhm.
going to find out what the end product is.
One of the courses you taught me, you saying, okay, imagine your learner leaves this activity, goes outside, and the TV reporter runs up to them and said, "What are 3 things you learned?" I thought that was a really good analogy.
Ooh.
It's a
I
good
used
one.
to do I used to do training for pilots, captains
Oh,
of
okay.
airlines, and
Uh-huh.
we did this attack journalism course where
Uh-huh.
they would get off the plane after an incident, and there would be a news crew, and we would be that news crew. And
Mm.
it taught me so much about instructional design. It's like, wow, I got to
Yeah,
have this all packaged up pretty good before I ever step out into this. I have to know where I
absolutely.
want to go and what I want to accomplish.
Mhm.
And it is that kind of attack in the sense that, yeah, you're going to be
Mhm.
challenged on this. You have to be able to
Mhm.
show that these things work and this learner can learn and did learn with mastery. So
Mhm.
I'm so glad you brought that up. I don't even need to talk anymore. You can just do this show.
You taught me well.
I'll tell you, as a new person in the instruction in the well, it's called Learning and Performance Technology at UMBC now, but the ISD
Uh-huh.
program. As a
Uh-huh.
new student in there, I appreciate what you just said because just with some of the assignments that I'm doing within my program, it can be very overwhelming if you look at the assignment as a whole and you say, oh my goodness, how am I ever going to do all of this, right? Am I going to be able to grasp this and actually do it? And it really is about chunking it down to small steps. It's taking, and I love what you said about keep the end in mind. Really, point A to point B, keep it as simple as that at first so that you don't overwhelm and you can think strategically. And it's a process. And it is a process. That's what I love about what I'm learning, is that it is a process, and that makes it less overwhelming, because a process is step by step by step. And as long as you dot your I's, you cross your T's, and you analyze, you evaluate, you get the feedback, because it's so critical. You have those critical discussions with the right people, and you just keep your head on straight.
Absolutely. Absolutely. It's very logical. I do love the cognitive theory of multimedia learning. I love that. It's where people learn better with words and graphics. So I'm actually in a PhD program in health profession education. So I like to say I'm getting a PhD in cartoons, because I'm very interested in the impact of infographics. And students love infographics. So you're never too old.
I'm just going to sit here and take a nap, because I don't know how you keep up with yourself. You do all these things. So now we're going to have some fun. We're going to do the half questions. And you can do as many of these as you want to. You can not answer them if you want to. You can have your own if you want to. We have 10 that we've picked. And these have nothing to do with ISD, by the way. Absolutely nothing.
Okay.
Absolutely nothing. Are you ready?
Okay.
1, 2,
I'm ready.
3. Let's spin the wheel. Woo! Okay. Take out or dine in? Which do you prefer?
Well, this last year, of course, takeout.
Of course.
That was a no-brainer.
Let's pretend that COVID does not exist.
Yeah.
We did some meetings at Subway, I recall.
You did.
That was our glorious dining experience.
I was buying. That's why it was a cheap date. My husband and I love to eat out, but of course not for the last year. So that was kind of they sunk our battleship there.
Okay, you want another?
Sure, hit me again.
All right.
Well, dog or cat? My dog, I threw her out of the room, so we're totally dog people.
Put her back in.
I think it's dog or cat. Yeah.
Piano
dog or cat.
We have a dog. We've always been dog people. And piano or guitar, I play both. And the banjo and the organ, so there.
Wow.
When my nails are short, for strings. Piano mostly.
Why am I surprised?
And I bought a ukulele in Hawaii a year ago. So
I have one hanging on my wall right now. I've never used it, but my brother-in-law used to live there, and so he got us a ukulele. It's beautiful. It looks adorable, but never played it.
That's right. Yeah.
What is it? Tell me the difference between a piano and an organ. I mean, I know the sound difference, but is it really? Is it very, very difficult to make that transition, or are they pretty similar?
There's a pretty fair skill set that you have to assimilate. There, for one thing, instead of 3 pedals down below, there's like 5 billion down there. So how you hit the pedals is very important. How you hold the keys, how you sustain the key. Reading the music is the same, of course. Yeah. So I made an easy transition to organ because I had already played the piano for years.
What is
That's
your favorite?
Why I play guitar.
My favorite.
What is your favorite?
I can read
instrument?
Music and guitar. Oh, the piano. Absolutely. I have a beautiful 6'4" black ebony piano in the living room. It's gorgeous.
Oh, yeah.
And you have time to play it, don't you?
I wish I had more. I do. I really do.
When's the last time you played it? When's the last time?
A couple weeks ago.
Really?
Mm-hmm.
Middle of the night?
Yeah. I'm up in the middle of the night often. That would be for needlepoint, but
I do
once
know
in a
that.
while. Yeah.
What kind of music do you like to play on the piano? Classical? Jazz?
Everything. More classical, I would say.
Yeah.
But holiday music, Christmas music, when it's appropriate.
Yeah.
So.
Yeah. Well, back when we can all get together, I'll bring my guitar. Denise will bring her ukulele, and we'll come out to the bay and we'll sing.
We'll do some picking and grinning. There you go.
There, that sounds perfect.
I mean, what better place? You got a big deck looking out on the bay, right?
Let's do it. Absolutely.
Oh,
absolutely.
I'm in. Especially if it's
let me thank you.
I'm sorry. I want to do one more.
Okay.
Let's do one more.
You're not getting out of
one
this,
more.
apparently.
Okay, ready?
Denise is on a mission.
I'm on a mission. I like my new wheel. Oh, we already
did dog or cat again.
Yep.
What's the one next to the green?
I'll whoops. Okay, well, whoops.
Run or walk? Well, I don't have the knees to run, so I guess I'm going to have to walk.
I don't think I don't either. Like once 50 hit, it's like, oh
Yeah, I
Yeah.
Peloton. So I
There
have
you go.
Peloton. They come
Wow.
after me and make fun of me, so that works. But
Well, good for you.
well, Lynn, this
Good
has
for
been
you.
so much fun. Thank you so
Absolutely.
much.
Thank you for asking me. I appreciate it.
Yeah, I've
And
learned
good
And
so
I
luck
much.
with
hope
your.
you. Well, what can we do for you with all of your exciting stuff? Is there anything that we can tell people and let people know?
Well, I just appreciate all the support you've given me, Chuck, from teaching me years ago in the classroom to always being a good sounding board for me when I reach out and ask. And you're teaching in the master's, you're going to teach in the PhD. I think you're awesome. I think you are literally the finest educator I've ever met in my entire life. And Denise, you're in a
Well,
wonderful program. So good luck to
I'm
you
going
as
to tear
well.
up now. I've had a rough day. I'm going to start crying.
Aw.
Doesn't take much, huh?
And you're my hero because one day I
Oh,
want to do half what you do in a day. So
oh,
there
there
you
you go.
go.
You
Yeah.
really are
So
inspiring. Yeah,
Thank
all
you. Thank
the
you.
the work that you do
Absolutely.
and the passion that you have, it's incredibly inspiring. And there's so many
Thank
people
you.
that are so fortunate to be the benefactor of that passion. And
Thank you very
yeah,
much.
yeah, it's been a great time, great discussion. If you have any comments, go ahead and put them in the comments. We will get back to you with questions and we'll field those to Lynn if there are any questions that you have. Thank you so much and hit the subscribe button. We'll see you soon.